Good morning to CSI TV studio and the weather in Mumbai, you don't have much to speak about. It's always hot, hotter and humid. But today we have ensured that in the venue, the temperature is going to be cool. It's right now at 21 degrees and it's very comfortable. As the day proceeds, you might have more people coming in and it will get more comfortable. Well, before I begin, I must tell you all that everybody should download the CSI app. Now, Jio is providing us with a 4G Wi-Fi, and first thing you do in your settings is to get this Wi-Fi enabled. When you go to this Wi-Fi setting, use the Jio net and it asks for your mobile number, submit that, it will give you the OTP, enter the OTP, and once you do that, you will be logged in for the next 24 hours. Please use this. It's a 4G high-speed connectivity. Once you've done this, if you have not downloaded the CSI app, do it now, either in your Play Store in the Android or in the App Store in the iOS. In the CSI app, we have very interesting features. Go to the e-resource. In the e-resource, we have CSI Live. What have we provided this time in CSI 2018 is that if you go to CSI Live, you will be able to see live proceedings in all the 4 halls, Hall A, B, C, D. So even if you are outside the halls, even if you are in Hall A, you can easily see what's happening in Hall B, C or D. Make the best use of it so that you have a platter of all the scientific content that's going on live at the same time. Similarly, CSI TV. CSI TV is live. So if you hit on that icon, you will be able to see the live proceedings of what's going on in CSI TV. All right, with this brief note, let me tell you what's in store today. I think we had a very hectic day yesterday. Almost 2,500 attendees were there in the 4 halls, 9 to 6, packed program. We had a fantastic inauguration by our Municipal Commissioner, Mr. Ajoy Mehta. And what a fantastic message he gave. He told us that medicine challenges technology and technology inspires medicine. Very true. But where is that human touch? The human touch needs to be preserved, needs to be intact. What's in store today in the scientific halls? Well, we have a joint scientific session with 2 big societies, ACC at CSI, ESC at CSI. In the ACC at CSI, we have emergency room to interventions, Michael Wellington, Richard Chazelle. In ESC at CSI, we have everything about dual antiplatelet therapy, non-STEMI, cardiogenic shock, Stephen Windecker and Marco Raffi. And we have plenary sessions. I think make use of this. Plenary sessions are going to run between 11 to 1 in the morning and in the evening between 4 to 4:45. Interesting plenary sessions. Mystery of HDL by John Chapman. Diabetes and cardiovascular diseases, Prakash Didwania. DM and DNB training. What's happening? Are we losing the track? Dr. Satyavan Sharma, our organizing chairman. Dr. P.K. Deb is going to highlight on DAPT. Update in the management of stable coronary artery disease. None other than Samin Sharma guiding us through optimal medical therapy, percutaneous coronary interventions, or bypass surgery. Jagat Narula is going to help us in revascularization of a stable angina patient. Is it the eyeballing of the stenosis that's important, or we need more imaging like FFR? Jitendra Merkar is talking about TAVR. What is the current status? Hypertrophic cardiomyopathy. How do we prevent sudden deaths? Martin Maron. Secondary prevention ACS. Michael Valentin. John Cam, the most revered electrophysiologist, is going to help us. What is the value of real-world assessment in the use of anticoagulation for atrial fibrillation. And finally, we have an update on the use of antithrombotics by John Cleland in heart failure patients. Also, we have interesting debates. A few of the debates, if I highlight, I must say that STEMI, what happens to patients in STEMI in the 24 to 48 hour segment? Do we need to do revascularization immediately or later? The cholesterol controversy, have we been fooled all these years? What is the role of devices in LV dysfunction? Is there a role of CRTP at all? And finally, the most awaited session is going to be by Professor Eugene Braunwald, 5:30 p.m. Don't miss it for the world. Well, the other thing which I need to highlight or mention about is that today the Hall E is open. Hall E has e-posters and oral abstracts. Make use of it. First time a concept where poster presentation is happening on an electronic format. We have 12 stations, 9 to 10, 10 to 11, 2 sessions. In one station, we're going to have at least 8 presentations happening. So through the day, we're going to have roughly 200 presentations today, 200 presentations tomorrow. In the afternoon, 1 to 5 p.m., we'll have the oral abstract presentation happening. So Hall E is going to be open today. Now, 2 other areas which we would like everybody to make utilize of what we have created is, for the delegates, it's Meet the Experts Lounge. Please make use of it. Meet the Expert Lounge gives you a platform wherein you will be able to interact in a one-to-one manner with the international and esteemed national faculty. Meet the Expert Lounge is on the right side of the trade area. There is a special space created. US Whitman people are helping to get this lounge functioning. We have important faculties. You can spend 1 hour with them in a roundtable format, clarify all your doubts, all your clinical dilemmas. It is going to run in the morning 10 to 11 and in the afternoon from 1 to 5. You can also, you need to pre-register. You need to book your appointment with a particular faculty. You can do it through the app or go to the US Whitman stall and in the lounge and register yourself. And finally, we are having a CPR workshop. We have realized the importance of reviving a patient with sudden cardiac arrest. It's very important. It's a basic CPR course which we are going to start today. The eye care team, the Life Institute Health Supporters team are going to teach us about CPR, basic CPR. It is essentially meant for the trade people, for the spouse people, a 1 hour short training program where there will be a brief take-home message and then a hands-on CPR training. How to identify a victim of sudden cardiac arrest, how to call for help, what should you do in terms of chest compression. It's a chest compression only message that we are going to give because that's the thing which saves lives. So everybody needs to do this, learn this and make use of AED. I wish you all the best and have a great day today. Thank you.